Anal canal is the site of volcano. Oh, please don't take it otherwise. Here, what we are saying is the anal canal. It is the terminal part of our gastrointestinal tract. It is divided into three zones. That is, this one is upper or columnar zone. In the middle, this is the intermediate area, and this one is the lower or cutaneous zone. In between the upper and the intermediate zone, this one is the pectinate or dentate line. And this is the site of volcano. V for venous drainage, O for origin, L for lymphatic drainage, C for classification of hemorrhoids, A for arterial supply, N is the nerve supply, and O very much sounds like E, that is epithelium. This pectinate line is the watershed line, and it has got double, all these double venous drainage, double origin, all these are double because from above they are different and from below it is different. First come to venous drainage. Pectinate line and above, the venous blood is drained into superior rectal vein, which is the continuation of inferior mesenteric vein, one of the tributary of splenic vein. Portal venous system is formed by the union of splenic vein and superior mesenteric vein. So, superior rectal vein is the part of the portal venous system, whereas the pectinate line and below, it is drained into the middle and the inferior rectal vein, which is one of the tributary of internal iliac vein, finally drained into the inferior vena cava. So, part of the caval system. Now, volcano, another is O. O for origin. Pectinate line and above, it is developed from cloaca, the caudal part of the hindgut, and especially the anorectal canal, which form the upper 1/3 of anal canal. And the lower 2/3 develop from proctodium, which form lower 2/3 of anal canal. Cloaca, we all know from where our GIT is developed, so it is endodermal in nature. Whereas proctodium, it is ectodermal in nature. So, the different origin from that line. Volcano, L for lymphatic drainage. Pectinate line and above, the lymphatics drain into the superior rectal node, which will finally going to the internal iliac node. And below the pectinate line, the lymphatics drain into the superficial inguinal lymph node. C for classification of hemorrhoids. Pectinate line and above, the vein become inflamed and dilated, known as hemorrhoids. If it is above, then it is internal hemorrhoids. It will classify as internal hemorrhoids, which is pain insensitive, painless. And if pectinate line and below, the hemorrhoids will be classified as external hemorrhoids, which is painful. Painless due to autonomic nerve supply and painful due to somatic nerve supply, which we will discuss later on. Okay. Now, volcano, A for arterial supply. Pectinate line and above, the blood supply is by the superior rectal artery, which is the continuation of inferior mesenteric artery, one of the three ventral branch of the abdominal aorta. Whereas pectinate line and below, the arterial supply is by the middle and the inferior rectal artery. Middle rectal artery is the branch of anterior division of internal iliac artery, whereas the inferior rectal artery is the branch of internal pudendal artery, which is also the branch of anterior division of internal iliac artery. And for nerve supply, pectinate line, volcano. And for nerve supply, pectinate line and above, it is supplied by autonomic nerve, and below it is supplied by somatic nerve. The reason why above it is painless and below it is painful. O very much sounds like E, so epithelium. Pectinate line and above, it is covered by columnar epithelium, whereas below by the stratified squamous. Again divided into two up to the white line of Hilton. It is by the non-keratinized stratified squamous, and below the white line of Hilton it is keratinized stratified squamous epithelium. So the junctional point, pectinate line is said to be the junctional point of having all these things double. Thank you. So pectinate line is the site of volcano.